This session was recorded on the 21st of July 2022 as part of the National Cancer Patient Experience Survey 2021.
Good afternoon, everyone. Thank you. And can I just say an enormous thank you to everyone for taking the time out to join us today. Personally, I think that the Cancer Patient Experience Survey is one of the most important things we do as an NHS cancer programme. It's absolutely vital that we listen to, as Kynwyn has just articulated far better than I could ever do. It's vital that we listen to the views of the people who use our services so that we can basically improve the service we provide to them. And CPES is a really important way in which we do that. It's the single biggest survey of the views of cancer patients every year. Roughly 60,000 completed the 2021 survey, and therefore I think it gives us the best possible indication of how cancer patients view the services we provide to them. 2021 was obviously a really tough year for all of us in the NHS and for all of us across the country. It was a particularly tough time for cancer patients. You know, having cancer is a worrying thing for people at the best of times, and the pandemic, you overlay that with a pandemic, which was certainly not the best of times, and it inevitable that is going to have compounded some of the anxieties and concerns of people with cancer. Many, we know, during that period did have to experience changes to their treatment plans, although, you know, it is really important to remember that thanks to the efforts of colleagues across the country, the overwhelming majority of cancer treatment did continue during that period. Many cancer patients will also have been very concerned, as Kynwyn has touched on, about their increased vulnerability to the coronavirus and what that might mean for them. I think that makes it all the more extraordinary that in 2021, the feedback that all of you got from the patients in your care was the highest it's ever been. The key question in the survey is, you know, how did you rate your overall experience of care? That's been the same since 2015, and so I think it's entirely legitimate for us to compare the 21 survey results with previous years, and it was the highest ever, 8.92 out of 10. As keen students of the Cancer Patient Experience Survey will know, my go-to document when I get the CPES results is the Institute of Customer Service benchmarking reports. Now, Institute of Customer Service is a great organisation. Many blue chip companies, public sector companies and others subscribe to it, and I think at least a couple of bills setting out how the public rate the services provided by those companies and other organisations. July, coincidentally, they published the most recent outputs in July 2022, and really interesting what the three. This does change from year to year. The three highest rated organisations in reverse order were. Anyone want to guess? John Lewis, with an overall customer satisfaction rating of 86.3%. Timpsons, I love Timpsons, I think they're a great shop, and they had an overall customer satisfaction rating of 86.4%. And then, intriguingly even, UK Power Networks was number one, with an overall customer satisfaction rating of 86.5%. If you turn our 8.92 customer satisfaction rating into an Institute of Customer Service percentage, we'd have been on 89.2. So we wouldn't just be top of the country; we'd have smashed all of the competition by nearly 3 whole percentage points. And you know what's really great about today's call is just to see how many lead cancer nurses and other colleagues from around the country are on the call. It's your leadership, your dedication, your skill that's delivered that sort of patient feedback from the people in our care. So after this call, not before the end of it, I do want you to go back to your MDTs. I want you to go back to your nursing teams, your pathway navigators, your reception staff, your porters, your meals staff, and tell them just how bloody good they are. Yeah, tell them what a magnificent job they have all done in delivering this sort of valued and service from the patients in our care. And I think that's the single most important message for me to give you on this call. It's an absolutely brilliant result, and so thank you for all you have done. At the same time, that's not it, I'm afraid. It's lovely to get this pat on the back from the people in our care, but CPES really, and the publication of the national report is really just a starting point for us as a health service. It gives us an indication of where we need to look a bit more deeply so that we can begin to improve the service that we provide even further. It would be great to, it'd be great to smash the competition by 4 or 5 percentage points next time round. Let's see if we can do that. And I think there are indications in the 2021 report, and Kindwin's touched on some of them already, about where we do need to start to look. Firstly, we know that there are certain groups in the community that, they still rate, by the way, they still rate our services really highly. Yeah, they are, on average, these groups are receiving a very good service and happy with it. But they do, but the feedback they're giving us is just slightly less positive than it is overall. So the ones I would pick out, interestingly, are Asian people, who rate our services overall at 8.54 out of 10. So pretty good, but below 8.92. Women, interestingly, who rate their services at 8.87 out of 10, slightly lower than men. Younger people, who Kindwin I know will be particularly concerned about, given her work with Shine. The 25 to 44-year-olds rate our services overall at 8.44 out of 10. Still good, but not as good as overall. And why is that? And the last one, possibly the most concerning from my perspective, is people with learning disabilities who overall rate our services at 8.01 out of 10. So really quite noticeably lower than the average. Still pretty high. And it's also really important to note that there are relatively few people with learning disabilities completing the survey, but still something I think we do need to look at and we do need to take seriously. So, it's a starting point for me. But again, when we do look into this, I think make sure we're not sort of starting from a deficit position. Look into it with confidence, looking into it with the confidence that that we are delivering a high level of service to all the groups in our care, but we just want to work harder for those who have given us a slightly lower rating than others. The other starting point that CPES gives us is, and again, Kindwin's touched on this already, is it's given us an indication of which aspects of our care perhaps is not rated as highly as others. So care planning, what more could we do to ensure that the work we do with patients on their care planning meets their individual needs? Communication, always a real challenge for the NHS, but what is CPES telling us about how we're explaining people's diagnosis, their treatment, and then their what to look out for when they complete their treatment in terms of a cancer potentially coming back. And then thirdly, primary care. Clearly the support that some patients are getting from primary care is falling below the expectations that what they expect. So, how can we work with colleagues in primary care to improve that? So it's a starting off point. It will be a starting off point for many of you within your individual trusts. And I would warmly encourage you to look carefully at your individual trust results. At a national level, we're doing a couple of things to support you with that. The first, my colleague Claire Marshall, who I can see, sorry, too many Claires. My colleague Claire Marshall, who I can see on the call, will be continuing to lead our work on the Cancer Improvement Collaborative, which many of you will have taken part in, and I think is an absolutely excellent programme of work, really to get under the skin of what CPES is telling us. And I know that many of the trusts that have participated in the Cancer Improvement Collaborative have felt it's really benefited them in terms of improving understanding and improving the service that they provide. Secondly, what we'll also be doing this year is more detailed analysis of some of the free text outputs from CPES. Really interested to see what insights we get through that. This builds on a number of improvements that colleagues at PICA and in the patient experience team in NHS England have made to the report in the current year. Again, I hope these are massively helpful to you as you're taking the results of CPES and thinking about how you learn from them. We've improved the wording of some of the questions to make them a bit more intelligible to patients, removing some of the sort of the lingo that we use, like cancer nurse specialist, but which not all patients will necessarily understand. There are more questions, particularly on areas like the living with and beyond cancer stage. That we're capturing more insights into patients' experience of that part of their cancer pathway. We're also publishing more granular data for the first time, so you'll be able to see data on 38 cancer types, which again I hope will deliver more insights, and I'm sure colleagues in the cancer charities will be scrutinising those results very closely. I think I'll stop there because what I want to do is leave as much time as possible, both for colleagues from PICA to take you through the results in more detail, because I think that's the most important purpose of today, and also to respond to any questions that colleagues may have from around the country. Thank you again for all the work you do, have done over the past 2.5 years in particular, during what has been one of the most turbulent and challenging times in the NHS's history. I wish, to be honest, I wish the CPES report has received more media attention than it has, because I think you deserve it. It's testimony to the terrific work that you and colleagues around the country have done, and I hope you're enormously proud of the feedback that the patients in your care have given you.